Good morning, everyone, and a very warm welcome to this SafeHabitus webinar on defining safety and health management priority needs in agriculture. Firstly, it's great to see participants joining us from across Europe, and thank you to those of you who joined us yesterday and are here again today, and welcome everyone who is joining in for the first time today. And I can see from the list of participants that we've got people from right across lots of different important areas, including research, policy, advisory service, and also farming communities. So it's great to have all of those people with us today. And that's particularly important for this topic because we're going to talk about the needs that farmers and farm workers have in relation to health and safety and how we might meet those needs. So it isn't just a case of farmers having to be safer, in other words, about their individual behavior. It's also about who can support them to adopt safer practices. So as with all SafeHabitus activities, today's webinar directly responds to the original mandate set by the European Union when it called for research in this area. And that mandate includes improving understanding of the full range of occupational safety and health challenges faced by farmers and farm workers, and to translate that understanding into better policy, governance, and management frameworks. And this is important because agriculture remains one of the most hazardous sectors in Europe. Farmers and farm workers face a unique combination of physical risks, environmental exposure, psychological strain, and organizational challenges. And what makes this particularly complex is the diversity of European agriculture. We have many different types of farm systems, labor arrangements, regulatory contexts, and cultural traditions, all operating within a sector undergoing rapid economic, policy, technological, and climate-related change. So this webinar focuses on defining and prioritizing those safety and health challenges, not as isolated problems, but as management issues embedded within wider farming systems. Understanding what the priority needs are and for whom is essential if we want to make safety and health interventions to be realistic, targeted, and effective. It is also essential in ensuring that we involve those organizations that are best positioned to support farmers adopt safer practices or healthier practices through the provision of knowledge, advice, and supports. So in terms of some of the house rules today, firstly, I want to encourage you to ask questions. So please, in the chat, put your comment or put your questions into the Q&A section, and we will answer those either directly after the speaker presentations or at the end during the discussion. And there's also the chat function where you want to engage if you want to add your own voice in there, your own perspectives on what some of these issues are. The webinar is being recorded, and the recording will be made available next week on SafeHabitus' YouTube channel. Please keep your camera off and your microphone muted. As I said about the questions, insert them into the Q&A, and we can chat to each other as we move along. So next slide, please. So in terms of the agenda that we have today, this program, and thank you to Jarkko for leading the development of this program and the support of colleagues from across SafeHabitus for fleshing it out. So today's program brings together insights from across the project. We begin with Risto, who will set the scene by outlining the main safety and health management challenges currently facing the agriculture sector. And this helps ground our discussion in the realities of contemporary farming work and the evolving nature of risk. Then we hear from Jarkko, who will present findings from the 11 SafeHabitus communities of farm safety practice. And these communities are drawn from across Europe and have worked closely with national stakeholders and farmers to identify key occupational safety and health issues, the populations most affected, and the management needs emerging from their own contexts. To bring this to life, Jocelyn, who's the administrator of the French Farm Safety Community of Practice, he'll present concrete examples of how priority safety and health needs have been evaluated in France. And this provides a valuable illustration of how participatory, context-sensitive approaches can support better decision-making. And finally, we'll look to the future. And Peter from the SafeHabitus Scientific Advisory Group will offer a forward-looking commentary on future development needs in farm safety and health management. So each session will be followed by an interactive question and answer segment. And as I said, please put your questions into the Q&A section and engage in the chat side of things. So next slide, please. And finally, some advertising. We have another webinar tomorrow, and this will really look at how to implement risk management approaches in practice. And then that will be followed by a number of events in March, but the one that I'm spotlighting right now is a policy workshop, and it's looking at the potential role of new technologies in improving health and safety on farms. So we would be delighted if you can join us for those events. So with that, I'm now going to hand over. Risto, if you want to begin by setting the scene.
Okay, thank you, David, for the introduction. And let's see, can you see my slides now?
All good, Risto, yes.
Okay, very good. Okay, yeah, thanks for the invitation to be in this session. I'm joining now actually from the United States, and it's nighttime here, so I may not be at my best, but yeah, I have worked with Jarkko Leppälä on this Luke project, for this project, SafeHabitus. And so now let's get into the topic today. So managing a farm, that is a big job. You, as a farmer, may have some role in managing everything you see in this picture. Maybe not so much on the lake and behind it, but other things that you see. So there's a lot about strategy, what do you want to develop, the finances, the production in the fields and the forests, and taking care of the environment, compliance issues, human resources, who does all the work, home and family issues, and well-being of all of the people. And I put occupational safety and health here at last. And often when having to do all of this, the safety and health is probably not the top thing in farmers' minds, but it should be included in all of the things that are done in sort of a safety culture way, thinking about the safety issues related to everything that we do. So why do occupational safety and health management priorities matter? So we, as I think we hear often, agriculture remains one of the most hazardous sectors in Europe. Still a lot of fatalities, non-fatal injuries, and working conditions that contribute to early retirement or chronic illnesses, and mental health and isolation are problems. And a lot of these issues we don't even know well enough because self-employed farmers and family workers are not included in a lot of the reporting systems. And so if we could focus, understand the priority needs, what the problems are and what could be done to improve things, that could be a step in the direction where these risks could be reduced. So how do we look at the priority needs here? So I'm looking at them sort of from two perspectives, needs based on the current challenges and what evidence we see as far as potential problems. So injury, illness, disability, and structural risk factors. Then needs that are based what we think that should be done in the future to make things better. So public investment, farmers, attention to safety, and understanding what might be emerging issues where we don't even have really good evidence yet about how harmful they might be. As mentioned, the diversity has to be considered. There's so much differences in the agriculture systems, farming systems. In some countries, it is based on larger commercial farms. In many countries, small family holdings, and or different combinations of them, and the differences between east and west, north and south, and different occupational health and safety support systems are very different. This was from the previous SafeHabitus work, trying to lump countries in similar groups where the conditions are quite similar for developing health and safety activities. That you can read about in, I think it was 3.1 working group report. The injury experience in Europe is quite well described here in the slides, and this combines both non-fatal accidents on the y-axis and fatal accidents on the x-axis. So like way on the right side, for instance, you see Austria as a green dot, 30 fatalities per 100,000 people in a year, which is a lot. And then for non-fatal injuries, if you look at it, it's about 2,500 non-fatal injuries. Anything below the line or lines, you would most likely have a situation where both injury types are very seriously underreported. And the countries at the top, France, Finland, Spain, Italy, are probably the ones that have it just about right, not missing so many of the injury and illness situations. So, and they have in common that they have social insurance systems that produce the data. If you don't have them, then the data is very difficult to get. Finland has a very good system for getting data collected, and so we know about the accident causes. This is a 30-year data set, so there's a lot of cases from where you can see how the distribution is by accident causes. I don't read them, you can try to read as quickly as possible. And work activities where the injury happened. Animal work is by far the biggest in Finland. Forestry is quite a large part. Taking care of the buildings is quite a large part. Other farm work, then reindeer, herding, fishing, smaller ones. Crop work, not nearly as big as animal work, but that is different in different countries. Occupational diseases are compensated in Finland as part of the accident insurance, and you can see the development there. It would be a longer story, but some good developments have happened, mainly because of the technologies related to dealing with hay and straw and other materials that used to be baled in a way that they got moldy and created farmers' lung, other problems, respiratory problems. So what is special about farmers as far as chronic health conditions that take them out of work? So this is the comparison of all workers and farmers being the yellow part, divided or distribution by ICD-10 codes. And you can see we often talk about mental health being a big issue, but here it is not as big issue for farmers as it is for other people. And I think it depends, or it is because of the way farmers are. There's not an employer who is observing them in the same way that what happens in an employment situation. But what is the big issue really for farmers is musculoskeletal conditions. And so we can we can see what happens to farmers, especially dairy farmers in Finland, when they start getting older. For males, when doing the workability index questionnaire, it shows quite clearly when you look at the trend line that your workability towards later years really goes down. And when you look at the women's situation, it goes down even steeper and more drastically. So if you get into the 60s, 70s, most farmers who do very heavy physical work are really at the point where it is questionable how long they can work anymore. And so therefore, in Finland, the retirement systems have really helped giving farmers an opportunity to retire and pass on the farm to younger generations, which is really, I think, what should be done. We have done systematic reviews and meta-analysis of risk factors. These are more like structural issues, not like injury causes, but what increases the risk of injuries. So challenging social conditions, if you have quarrels within the family or neighbors, your injury risk is 3 times higher than if you don't have those problems. Higher income, larger farming, higher risk, twice as high risk compared to smaller. Hearing loss doubles your risk. More hired workers, stress and depression almost doubles your risk of injury. Having a prior injury almost doubles your injury risk. Animal production, chemicals, pesticides, male gender, males 1.7 times higher risk. Unsafe practices, high perceived injury risk, owner-operator versus other. Regular medication use, 1.57. High school or higher education is actually a risk factor here. It's interesting. Computer use at the farm, risk factor. High farm sales, risk factor. Not getting enough sleep is a risk factor. Finnish language versus Swedish language farmers in Finland. Swedish-speaking farmers are safer, which is a long story, but that's how it is. Culture matters. On-farm residence, greater farm size, Caucasian race versus other, is protective here. Not significant was having health problems, alcohol use, safety training did not seem to make a difference here. Marriage, no difference. Off-farm work, no difference. And smoking, no difference. So those are some of the sort of things that put farmers at bigger or higher risk of injury. So then, what did we found as far as when doing this analysis? Jarkko will continue in detail. I will just mention a few sort of higher level findings, and Jarkko will give you the details and conclusions I think we can discuss. So we had a multi-actor consultation across 11 countries where there's communities of practice in SafeHabitus. So over 200 identified hazards and needs were identified in this data collection, and great differences across different stakeholder groups, structural and behavioral dimensions. So farmers want practical risk control solutions, and they are concerned about the time and labor support for getting improvements done, and they want trusted advisory channels. Public sector, better data systems, integrated safety services, policy coherence. Research and education, people thought that we need targeted training models and participatory approaches for training. And private sector representatives emphasize technology innovations, coordinations with advisory systems. And so farmer perspectives in a different survey,
Minutes left, Risto, sorry.
Okay, good. Almost done. Strong awareness of major risks. So farmers know a lot about the risks, and source constraints is a problem. Different engagement preferences. So current problem-based priority needs based on evidence. So improved injury and disease surveillance is needed. Include self-employed in the reporting. Strengthen advisory services, target high-risk machinery, livestock operations, and address mental health issues, and future-oriented findings. So integrating occupational safety and health into common agricultural policy, align safety with sustainability and climate transition, support generational renewal and safety culture, expand relief systems, and include safety and health in communication. And so occupational safety and health must be mainstreamed, not in a silo, and preventing must be societal and systematic, not just something that we expect farmers to do alone. And policies must account for U.S. diversity. And then there's a long list of sort of what could be done on a national level as far as structures. This may be too much to read, but this is what I mean when saying that we should just not expect that the farmers alone will do this. Farmers need support from different types of sources, and this is a list where if this was done on a national level, we would be in much better shape. Thank you.
Thanks a lot, Risto. Perfect timing. I think we can give 5 minutes for the Q&A session. We have actually a comment from more than a question from Dr. Kultus in the Q&A section, where I don't know if maybe we could dive in deeper into this comment if you want to take the floor, Dr. Kultus. Just raise your hand and we can enable your microphone if you want. Otherwise, here Jocelyn asked if you could let's explain a little bit better the table regarding the risk factors. What are the other elements in the table, OR, LL, and UL?
Okay, yeah. The red numbers are the risk estimates, and the two other columns were confidence intervals for that estimate. So it is basically an estimate where with 95% confidence, the estimate is somewhere within those limits, upper and lower limit. So, but look at the red numbers. So basically, the injury risk when you have, let's say, you have dairy production versus not have dairy production, your injury risk goes almost double higher compared to not having the animal production. So that's how that works.
Thanks a lot. We also have another question from Evie. In what ways does higher education function as a risk factor? Can you elaborate a bit more?
My opinion is that those with higher education, they pay more attention to their problems and issues, and they are more ready to report them. That I don't think it gives a true picture of the real situation.
Thanks a lot. And then Jarkko, I see you have your hand raised, please.
Yeah, about the education. I think, well, I had the same question in my dissertation from Finnish farmers, and the educational farmers had more injuries. And I think there was also that those farmers who have better education, they had also bigger farms. And when you have bigger farms, you have more things to do and more activities So probably that would be also one reason for that education. And I think, Risto, was this a risk factor result from the different articles you found results in different parts of the world, and so might be those differences between cultures and geography. And
Yeah,
what do you think?
they are global search of everything that we found about risk factors for injury, and but they most of those estimates, they come from multivariable models where the farm size is already considered. So it's not explaining why the education is making a difference. So those are kinds of things that come up in the multivariable modeling as a real result when considering maybe 10 or more other background variables. So it is a real thing, not depending on the farm size. But I think it is about just awareness level and ability to be more ready to report it when somebody asks you.
Okay, maybe we have, let's say we can, I don't know if Klaus doubts about the last point on size of farms and risk has been addressed by Risto's last comment, because he was asking if you were saying that bigger farms have more risks because he made, let's say, he has opposite experiences. Maybe we can clarify on this and then move on Jarkko's presentation.
Yeah. I see the point there. It is, I think so in Finland that since our farms have been in and also in those studies that were included, I think in most countries the farms are quite small, and so the time at risk is smaller. But when you grow your, let's say, your cattle size from 10 to 20 or 20 to 60 or 60 to 100, you start kind of maxing out your available 18 hours a day. But then if you have 1,000 cows, you have employees, you are a manager, you are in a totally different role. And that's why I think the larger farms, when you get through some threshold, then you start being basically managing a larger farm where the risk experience is different. But these are mainly, I think, representing what happens on kind of small and part-time farms, kind of getting towards full-time and somewhere between.
Thanks a lot, Risto. I think now it's much clearer. And well, thanks a lot for your presentation and for taking the time to answer these questions and comments. I think we can move on to Jarkko's presentation now. So if you want to share your screen, Jarkko, go on presentation mode, and then as I did for Risto, I will tell you when it's 2 minutes left for your presentation. Thanks.
Yes, thank you, Gianluca. Yeah, it's nice to have a good discussion already. And thank you, Risto. So good morning. I'm Jarkko Leppälä from Natural Resource Institute, Finland, called LUKE, and work package 2 leader also in the SafeHabitus Communities of Practice work package. Community of Practice groups are multi-actor networks in each participant country, and they are kind of operative units in this project. The topic today is about the survey results we had on each country about their agricultural safety and health issues, challenges, and management needs. I have done this presentation with Professor Risto Rautiainen, who presentation you just saw, and now you can hear the picture Risto doing a tractor safety check with an agricultural student. So, but we have also results that communication and education was successful, but it's kind of very difficult to prove, but it is possible. Slipping, tripping on tractor stairs, or jumping from the tractor, combine, or other farm vehicle stairs are very typical accident types on farms. If you have seen modern tractors and combiners, they are these days quite high. I counted from Finnish Farmer Social Insurance Institute statistics, MELA statistics, that we have about 200 tractor accidents each year, and 25% of these accidents happen in tractor stairs. So if we adapt this to machinery safety education campaign, for example, and get rid of these, for example, jumping from the tractor, we can get many tractor accidents less and save €1 million accident costs in Finland, for example. So now you can buy the project for this. Actually, we did this project in Finland, and you can read that results about the impact of safety communication on machinery injuries, and we got really less accidents in machinery. Study outlines priority needs about the SafeHabitus priority needs register. We've first results already published in a report, Haber et al., Farm Health and Safety in the EU. Participant countries in this project are Estonia, Finland, France, Germany, Ireland, Lithuania, Poland, Romania, Slovenia, Slovakia, and Spain. And we did this study also with Dr. David Meredith and Diana Van Dorn, who participated. And the name of the project is Strengthening the Farm Health and Safety Knowledge and Innovation System in Europe. And you can find the SafeHabitus website address below. About the multi-active networks and community of practice in each country, they include representatives from farmers, farmer organizations, research institutes, universities, educational institutions, extension services, government, and private companies. And the priority need definition, officially here in the report, it refers to knowledge, requirements, solutions, measures, all resources necessary to address safety and health challenges and improve working conditions on farms. So basically, same issue that Risto referred, that we have to see the current problems and then about this future needs for these challenges. Data collected in a survey and workshops in year 2024, and we use qualitative thematic content analysis in this study to find the common and different priority topics on farm safety and health challenges and needs. The safety hazard we defined here as it's hazard factors causing sudden unintentional injury event, an accident. And health hazard here is grouped as exposure occurs during a longer time period, resulting disease or ill health. And underpinning construct are the kind of factors for the hazards, which we probably have another webinar or presentations later. And that's maybe Chagas and Diana Van Dorn is presenting later. About the focus in each country, and this is now what we should notice here, that the focus in each project countries, community of practice groups were different, and it divides the production like dairy farm focus in Finland, cattle in France and Estonia, sheep in Romania, and more like farm management and policy-oriented approach in Ireland, Slovakia, and Lithuania. Psychosocial and policy capacity building in Slovenia. And now the new, probably kind of popular word for this is that we should raise kind of the agriculture farmer resilience, and this is probably one what we should to remember later. And farm management and service-oriented focus in Germany and Poland, and migrant worker management in berry and fruit farming in Spain. Keep in mind these focus areas. We have here these animal handling safety needs, and we're talking about these sudden accidents. In animal handling, human-animal interactions were found kind of a bird needs, and animal behavior, understanding the animal behavior in these handling situation. For example, transportation and transfer has found a need and challenging. And what is always personal protection equipment, PPE use. And we use the right PPEs, good fit PPEs, and right PPEs for certain activities. A couple of days ago, we have a workshop in Finland. So do we know, for example, well, if we think about the exhaust gases from, which is a very typical issue now. For example, if you go to indoor barn, animal house, with the bobcat or a tractor, and there indoor you get the exposure to the exhaust gases from the tractor. What kind of PPE you are using, and that kind of questions we are talking with the farmers that is needed. And we start, for example, from the gloves. In every safety hazard need is that we have a proper working gloves. And I can tell you many accidents there have been in 10 years where these kind of clothes could have been preventing farmers. And the machinery safety courses and education are where we can get these kind of information and knowledge. Machinery maintenance, machinery safety, 1/3 of the machinery accidents are from the maintenance activities. And then if we think about, sudden accidents, biological hazard, chemical hazards, and ergonomics, they are kind of these sudden poisoning, for example, in biological hazards. If there's a mold, you can get the kind of poisoning symptoms, and understanding these kind of symptoms is and substances, what they are in the, for example, pesticides. Mental health, which one was first, egg or chicken? I agree that the mental health problem, stress and depression, could be a cause from the careless behavior and accidents. And stress and time pressure may come, for example, for if my tractor breaks just before the rust season in spring, and that could be a short-term stress, but maybe the serious one is the long-term stress. For example, from long-time economic and relationship stress would cause long-term stress, And I would see that as a kind of a risk issue, that if there is if you have a long-term condition with that stress. We had also study in Finland about the disability pension diagnosis on farm, and there has been increasing mental health diagnosis among aging farmers who have come sick, disabled, and are in risk to lose everything they got in life. Musculoskeletal diseases, as Risto mentioned, are very typical, and that example of disease which you notice when you are over 50. You did not care about the ergonomics when you were young, and you will remember it when you break your back or leg for the first time. And about that ill health issue that farmers have to work when you are ill many times, when you should be in sick leave actually. This is a priority issue in many farms and many countries, that they have to farmers have to work when ill because they don't have anybody to feed or milk the cows when they should be in sick leave. And then I have kind of a summary about the register need register study and the first results. Are here, but what are the common issues? Here you can see the common main aspects of education. I think still Risto mentioned about this targeted education and targeted training. When we know the data where the risks are, we can more likely to get the education pointed to those targeted issues which are challenging and which are needed on the farm. I
2
could
minutes
say
left,
that,
Jarkko, sorry.
Yeah, okay. Well, I'm coming to the conclusion soon. I could say that every country farm and also the policy and services needs is obvious. Policy make things happen and many times set the frames what services are needed, and also the incentives to that directions are needed. The problem in safety and health is that it is not necessary so in product prices of milk, but it may show in farming costs by accidents and health costs for the society also. What is the real cost of your food is a good question. Animal handling is an issue as long as people eat animal products, and I would say that this is going to be a long time, and that time we are working with the animals and animal handling safety in every country. Machinery safety is also a top issue, and automation is a new technology gives solutions but also new challenges. Machine has a different logic than human, and we have to understand that. Management is a key issue, for example, safety culture, which comes for that what kind of work habits you have on your farm. Do you have a proper clothes when working on a farm, for example? And the farm manager is responsible to check, do everybody wear proper PPEs and proper clothes in farming? Are you going to let the horses to the pasture with the crop swoosh on a t-shirt, for example? And also changing weather and work conditions. They have to be kept in mind, and that's a part of the management. And then there are these specific issues from each country, which we also noticed, and probably that's a kind of good to have that what kind of special issues every country have found. But we have to also notice what was the focus in these countries. So basically, if some country have the same focus, they might have also same kind of issues. About this is just that's a little bit detail of these issues, and we have also in our report more detailed version of these different priority needs. As a conclusion, and probably I go to this what is needed on farm production level.
Yes,
farm
please,
safety
Jarkko.
skills.
Wrap up. Thanks.
Okay, so I would say probably this is now just what the Risto told about this practicality, management, and education. And then what is needed in the public sector, safety services, data systems, policy coherence, and research and education, this targeted training and participation, stakeholder networking and collaboration, and in the private sector, safe technology innovations needed, and then coordination also with others. Okay, probably I could stop here and start the discussion.
Thanks a lot, Jarkko. I don't know if there are. I don't see any question from the Q&A section and the chat. If you would like to ask a question, you can also just raise your hand, and we will unmute your microphone. Any elements that you would like to discuss further with Jarkko? Let him. Do you think? Okay, Maida. Okay. Please, you
Hello,
can.
everyone.
Thanks.
It was very interesting to listen both presentations. And I just came to my mind that also the very important factor of health and safety is also for being socially secured. And I was a little bit missing this factor in your presentations, because social security offers to farmers also other access to training, to education, to services. And I think that we need to take more into account this relationship between being socially secured as a farmer, or being socially secured, for example, from other occupation activities. For example, in Slovenia, I would say 95% of those who are involved in farming are employed in other occupations, not in farming. So they are working in the afternoons, during the weekends, in the vacation, in the farming. And as statistics in Slovenia show, those people are more frequently injured than farmers themselves. So, but they are not counted in these statistics in farm injuries. So I would just suggest that this factor, social security, will be more included in the analysis. Thank you.
Yeah, thank you, Maida. I think it's there. And basically, I wanted to make it more simple, this presentation, and finding the major issues. So basically, it's there as a kind of a policy services. And it was actually in that slide which were more detailed. For example, Slovenia need about social security. I think it should be there. But for example, in Finland, we have a kind of a good situation about this social security for the farmers. But then the question is then actually that is it we have a certain kind of risk management in each country, and many times how big part of it is public sector, from the public sector, and many countries might have the private insurance companies who are providing these kind of security issues. So, but I would see that it needs, or most of the countries in or the networks are that some kind of public sector intervention is needed. and support for the health and safety. Just what I mentioned about that, it's difficult to see these health and safety costs on the milk price, but you can see it there in the production cost for the farmers, and that's the problem here actually. So we need a public sector intervention, I think, from the COPs in almost every country are saying this.
Thanks a lot, Jarkko. I think if there are no more questions, I'll thank you very much for your presentation, and we can move on to Jocelyn, I think. Thanks a lot, Jarkko.
Hello, everyone. I guess that you can hear me and see my presentation.
Looks good. Thanks.
Yeah, okay. So I'm Jocelyn Fagon. I'm working at the French Livestock Institute, and we facilitate the French COP activities, in fact, and would like to explain how did we manage the work to define and describe our needs in matter of occupational safety and health in agriculture. So just to go in the presentation, so how did we manage to collect the needs? First, we could split in 3 different steps. We drive, in fact, some expert interviews first to get an overview on main topics and all the issues that they were discussed in France on this occupational and safety health in agriculture topics. Then we analyze also some documents and statistics, especially on farmers and employees' health and safety. The idea was to explore and to be able to show also key numbers and figures and to share to other people and also COP members. And the last point, but maybe the main point, in fact, it was the idea to work together with other COP members. So some community of practices, as the other colleagues of SafeHabitus project, there were 11 community of practices, and the idea was to use this COP to organize some collective work, to set the stand, to understand the topics, but to go deeply in some topics and to make some priority. And so I will talk especially a bit more on this last part of our activities, in fact. So I would like to say that the main engine of our activities and brainstorming activities is this COPS meeting and COPS members. So we used some physical and virtual meeting to work on it. And just this community of practices, it's a connection among farmers, but much more about people who are connected to the field, agriculture or farming, that we would like to together, some people connected to this especially topics on occupational and safety health topics, and also connected to the labor issues, in fact. So here is the quick scheme of who were involved in our community of practices, but there were some researchers, advisors from extension services who work directly with farmers, some health and risk prevention officer who work also quite often on the field, some public policy makers, some applied research institute like ours, in fact, some advisors from chambers of agriculture, and also some teachers from university or from high school, in fact, to see some different level where they can discuss these topics with their students. And so that was the main point, that we need to get such community of practices to be able to work. And what we have done, the first step of the assessment, maybe it was to connect actors to our topics. And so we organized several participative activities. Is one, for instance, we are in a meeting room in Paris, and we make these sentences to see if they think that if they see some connection from occupational health and safety issues and quality of life at work. And I won't go deeply on all these elements on this mental map, but just to say that we had plenty of topics, and we tried to classify it a bit about gender issues, about real work, about management, about attractivity also of our profession, some economy and income. When you have some resources, it's easier sometimes to think about such also safety issues. And a lot of discussion was focused on human, in fact, and there were a lot of topics who were really closely, and we are really convinced, in fact, in our country and in our research and development activities, that when you talk about labor organization, working conditions, you're closely addressing health and safety on farm, even if it's not addressed directly. So that's why we make a quite big connection between these two topics, in fact, labor organization and safety and health in agriculture. Then we move to the second step, and we try to list, to comment, to discuss on some different activities or programs that all COP members had set up in their by their own or with some other partners on the field, to reinforce, in fact, this topic on farm. So we make some post-it activities like you are used to do now, maybe, and then we gather them by teams. We assess and discuss also their relevance, sometimes their lack also, and to see if we had some blind spot also in our way of thinking or way of acting. And then this is, for example, a list of ideas, needs, and sometimes solutions expected or sometimes already experimented that we could manage. So they are not classified by importance level, but much more like an alphabetical list here. But it's also connected to what Jarkko showed previously on his presentation when he makes some merge and analysis coming from the 11 COP. So here, maybe just the bold word, but we discuss a lot about animal accidents, chemical risk, and solutions that we try to find, ergonomics, human resources management, a lot about musculoskeletal disorder or disease or troubles or injuries, who are quite common, and especially also when you work with animals and in dairy sector, for instance, but not only. Some systemic overview also, as Risto told during the first presentation, and some One Health and One Welfare discussion was quite a good opportunity also to discuss. Some organization and risk assessment also, to work on it and to be able to identify some risk on your farm. And a lot of discussion was also connected to psychosocial risks, how to measure them, how to study and to be able to make some preventive activities, but also some psychosocial risk support for people who are working with farmers, who can see something, but sometimes they are not so used to show and to report something. So their posture was quite important also to develop. And also some activities about how to support farmers to change their practices, in fact. It's not only to have a good diagnostic, but also to help them to move on something else. And to continue, in fact, from this list, as you can see on the slide on the left. So from the previous list of ideas, we have selected some of them to share and illustrate within technical notes that we had used in this SafeHabitus project. So more or less, these four examples are our priorities, in fact, because we put a lot of efforts on these topics and we wanted to share also to other colleagues. So we put efforts, but we know that we have also a lot of efforts to do on this. So for instance, one was about to work on farm organization and labor management, as I said. So we describe a method to be able to to work on this, to assess some work, who is working, which task, when, and what they like or what they unlike, and you can discuss with farmers and be able to make some metrics, but not only to understand how a system is working. Some other priority was also to discuss about psychosocial risk and mental health in farming. There were a lot of initiatives who have been done for farmers and farm workers. Some tools to increase, in fact, the awareness of these topics. We put some networks of sentinels or people who are ready and trained to be able to discuss. And also some farmers retired who are able to discuss with farmers. And sometimes, as we said, some method is quite efficient is when they have some peer-to-peer activities. Sometimes it's more efficient than when it's an advisor who come and say what they have to do. And some helpline on phone or chat who have been done to try to help farmers to start discussion, in fact, on these topics with still a bit taboo, especially in agriculture. Some other was about musculoskeletal trouble and ergonomics assessment. Sometimes it's not the most impressive injury, but on long term is quite important to find some solution on it. So we show and discuss about some activities that we did, some ergonomic studies or some use on exoskeleton, for instance, who are not the main solution, but it exists on the market. So we would like to discuss a bit about it. And also sometimes to understand the cause and consequences of accident, especially when you involve cattle handlers in France. And we use some ergonomic method to analyze these activities when some prevention officer try to work on it. And the last point that we wanted to show and to discuss it was about how to improve the safety knowledge, in fact, culture in France and on farms. So, and we use some risk management document who are compulsory for people who are employing people on their farm. And this document is quite interesting also to start to think about what are the risk factors and what could I do to improve the situation. But at this moment, sometimes it's much more considered as a compulsory document for the administration and not only for how to improve the situation on their farm. So that's the gap that we have to fill. And the last step that we used, in fact, it was also to be inspired by other partners. And from our 44 technical notes, it was the first one, but we classified them by topic. We discussed all together with COP members, and we have identified some blind spots. And one, for instance, was about the security of the children on farm, in fact. And we have seen that colleagues from Ireland say that AgriKids was a company or working on these topics, and we would like to go deeply on these topics, and that's why it was important with this overview activities also to be able to choose and to go and to move on some other activities in France and to work together with colleagues from the COP, in fact. And just to finish, maybe a few words on our organization in France, in fact, because I have seen on Risto and Jarkko tables that sometimes we didn't say that the policy in France was a big issue. So it is an issue, but I think that we had organized a system. It works. Maybe it could be improved, but sure that we work with some EU regulatory and strategic framework in terms of occupational health and safety, and at the same as the public authorities of the law, some codes, some rules that they work. So this is the main framework. And then we have split, in fact, into the general scheme work with different authorities. And every 5 years, they produce a document, a national occupational health and safety plan, with a lot of partners to be able to discuss the needs and the next step for the next 5 years, in fact, to improve. And at the same time, we start with the same discussion, but colleague from MSA, so the mutual and social activities in agriculture. So the national level.
Jocelyn, sorry.
Yeah, okay, it's finished. The national level and the 35 local organization work with their 13,000 volunteers, delegates who have been elected by all the MSA members, farmers, and also employees working in agricultural organization. And they work also to design such document, a 5-year plan. And we discussed on it in the technical note number 8, but that's also important to get in mind. This action plan, in fact, are the guidelines for the action of the local MSA activities, and all the needs and answers are discussed here also to make these needs in action. So that's why maybe we didn't say that policy system was a big issue, because we start also on it, but they also discuss on these topics in this 5-year plan document. So thanks a lot, and I work with my colleague Gwendoline Eluin and all French COPS members on these activities. So
thanks a lot. That's a lot, Jocelyn. So let's see if there are any reaction from the audience. If you have any questions, please either use the Q&A section, the chat, or just raise your hand. I see for now the audience is silent. How, in general, Jocelyn, how would you, let's say, a bit more in short, how would you describe the outcome and the process of putting together this, let's say, the work behind this presentation throughout the years through SafeHabitus, this experience with the COP?
Yeah. So I think the next step will be to discuss and to show it in some national or local event to see some outputs. In fact, even if we are not exhaustive, we sometimes we can miss some topics. But the idea was, because we are quite a lot of people coming from different organizations, we had different point of view, and so the next step maybe will be to all together to be able to work on some specific topics, and that's why this 5-year national plan are important to make a guidelines for all of us. But sometimes it's important also to organize some specific action, like a training session, like peer-to-peer exchange to show, in fact, some good practices. And on these issues, sometimes people think that good practices are the practices that their parents do in the past or did in the past. And we think that sometimes we need to have some expert point of view also to change their way of thinking, and some that could be some activities to work on the field, in fact.
Okay, thanks a lot. Thanks a lot, Jocelyn, for this, let's say, looking at comments. Hopefully it will be feasible. And Jarkko, I see your hand up, please.
Well, hello, Jocelyn. And I think you had a kind of a session in YouTube in France with your COP network. How was it? And is it something what we could see? What kind of session you had?
A YouTube channel from our COP? No, maybe our institute, we had some channel, but not on our COP.
Okay. So it was kind of a broader audience.
Okay, but after sometimes we produce some videos also on some other topics, and there are some connection about work organization, for instance, and mental health or safety on farms. So, but we don't have a specific channel, in fact.
Okay.
But it could be an idea, sure. But I think that sometimes with SafeHabitus also we had a lot of materials to disseminate, in fact, and I guess that it would be maybe much more efficient if we could do it all together to put these videos even on our social network, but to identify SafeHabitus project who lead this in Europe, in fact.
Thank you.
Okay, thanks a lot. And I think we can move on to the last presentation for this webinar. Peter, if you can share your screen, please. Thanks a lot.
This is okay?
Perfect. Thanks a lot.
All right. Oh, it's okay. Thank you for inviting me to give some comments here and about the future, what I see from my perspective, and as I'm serving on the scientific advisory board committee for SafeHabitus, and I'm also working since many years at the Swedish University of Agricultural Sciences with health and safety in agriculture in different aspects. And when it comes to our area we are working with and looking into the future, I guess it will be a mix, as I see it, of old problems, the present problems we are dealing with right now, and new risks and challenges with, of course, be it on the road. And we will still have animals. They will be around us, and as we heard previous presentation, that's one of the major risks to physical risk we are dealing with, and that we can't get X out of that. We have to still cope with animals. Machinery in different ways, they might look different, but still you have to work with the machineries in different ways. And we see, like in Sweden, we had a lot of injuries, fatalities also, where people getting crushed in or under or between machinery or large tractors or vehicles of different kinds. So we'll have that kind of issues also in the future. And we have the exposure, of course, to nature and the weather as a farming situation is. That's the kind of goes with along with the profession. And we haven't done the industry health and safety as in other industries, like in offshore industries and things like that, oil industry. They have done so much thing in the mining industry and so on. But at least we know that most of the farming population, they know actually the dangers, and we know the dangers. But still, it's a frustrating situation when which continues to be one of the worst industries when it comes to health and it comes to injuries and so on. And looking into it has been that for many years, and looking at what Ramazzini he wrote in 1713, that proposing protection measures for Italian farm workers seems pointless, as they rarely or never seek care or never listen to advice. And sometimes it's you still think it might be part of the truth, at least. So that's the thing. And maybe we should think about it. Should we do everything foolproof? I mean, can we do? I mean, that when you put tractor cabs or ropes on tractors, that did a fantastic change. Looking at the fatalities, like in we had in Sweden, we got had a legislation for 60 years, and also when you got rid of the bulls and got into artificial insemination, that was also making big differences. So I mean, if we make big changes, we can of course do stuff. And engineering, that can be a solution, but not everywhere. And we have been talking also previous today about information and education. And of course, that's still needed and we are still doing it. But how can we make it better? And I've been around for many, many years, and I've seen many different type of programs or themes or whatever, actions to try to information, educate, and so on. And in Sweden, we have had a major, big EU-funded national program called something like in English, Safe Farmers Common Sense. It has to be it's in the head of the farmers, and it was for 5 years. And it was difficult to see injuries statistics, since, I mean, if you have programs, you have higher reports more frequently and so on. So it was difficult. But looking at the fatalities, if we looked for the fatalities 5 years before, and then those 5 years, and then 5 years after, and looked at the means for those 15 years, we could see that there was a 50% reduction during the program. But after the 5 years after the program was ended, it went up to the same level that it was before this intervention program. So my conclusion is that we need to have a long-term thing that can continue to be there. Farmers need reminders, and they need to be helped to deal with these issues about dealing with health and safety on the farm. And I wrote in a farming magazine that I think we should maybe have an online occupational health service that the farmers, when they actually are out in the situation, they can ask somebody online and show with the camera and so on. It's how can I solve this situation? Do you have any idea to how this risk situation can be coped with or whatever? I mean, we have to do something to make the farmers having constantly easy access to advice and reminding them about how to make their workplace a better place. I think that's might be one way to go. And mental health. I've been also around so many years, and I did part of my PhD in 1988. I had a study on mental health among farmers, but so many years it haven't been on the agenda really. But it's nice to see that now we have more holistic way of looking all together, on not only on the physical risk, but we look also on the mental health. And we also have to remind us that it links very closely together. And we saw in a study we did about mental health among farmers, full-time farmers in Sweden, we can see that they told us, in the farmers, that almost every fourth farmer had experienced an injury where they had to go and see a doctor. And they concluded that when they had this injury, they had been very stressed or having some mentally problems at the time, with being maybe had an argument just before with a wife or whatever, or it can also be like having bad night's sleep or something like that. So they were not focused. Then we have this connection about you have to be in good shape in order to work safe as well. It's not only about the safety of the tools or things like that. And then we see it's a lot of discussion in our society about green transition. And also we were asked to look into the green transition, and it's how do farmers cope with the green transition. But it's not in agriculture, it's not like going from one day we skip that kind of use of chemicals or go to using other type of solutions, or we skip fossil fuels, or we go to other type of solutions one day for another. And whenever we meet farmers and have a discussion with them, they're talking about it's a natural process. They have always seen that they're working with the nature. And when they make investments to make this green transition, they do it when there are reliable technical solutions or other solutions. And also it has to be profitable. So it has to be fit into their economy and be a good thing. So I think it's we as researchers, we need to also follow this development and be part of this development and see if when they make these changes in our, if there are any upcoming risks we haven't been aware of. Maybe there are good solutions, but we should also be aware that can be new solutions coming up. And that goes also for the climate changes. Everyone is talking about the climate changes and so on. And now we have a cold winter, so we don't know about that. But we have dry, it can be very dry, or it can be wet or hot or cold. And it's about also, it makes actual day from day situation for farmers, how to actually really handle those situations. It can be very stressful, worries, critical and dangerous situations may come up. I mean, have a lot of rain. I mean, then we can have more situations like that. But it's and the lonely farmer getting stuck with his tractor out in the mud when it's too much rain and have to cope with that situation. It creates very much stress and a dangerous situation, how he should cope with that situation. So, I mean, we have to maybe look into the effects and comments in different ways. And it can be the hot weather can affect the farm workers working out in the field when they have high work, very hot weather. And of course, that's for Southern Europe. That's a very part of the daily problem in the summer times. And it's also, we see that the technical solutions, we are very happy about everything that's happening. We have AI, we have the digitalization, automatization, robotization, GPS, machineries are working out in the barns during the middle of the night. And we've heard about there can be new emerging risks there. There can be more fires or problems like that. And you also have to risk farmers where we talk to say that, I mean, may almost need to have a part-time electrician employed instead of a farm worker, because it's so much technical issues I have to deal with. And we can have the power failures and we can cope with that, but maybe we can have sabotage, we can lose the GPS tracking systems, we can have thefts of sabotage and things like that. We can have not knowing how I'm very lonely. I'm maybe the only one who know to handle these technical systems. How access to service. Maybe I'm a farmer out in the countryside, far away from where there's a service. How to get spare parts, stress worries. So it's a lot of the new technology also creates a lot of new stuff to worry about. And then also, again, I think that's if we want to have more farmers in the future, the next generation, they can't accept to work like our farmers had been a lot of their daily situation. We see in our Swedish studies that is the really big challenge. They have a very poor work-life balance. And they feel bad about it. They don't have enough time to. They don't have time to do stuff. They don't have time to have hobbies. They don't have time to engage in agricultural organizations or going with their kids to a camp or doing stuff with their wife, and they have feeling bad about that. So they work way too much. And even if they have good money, they can't even find solutions to get some kind of a farmer relief service or something, so that, or other type of solutions. I think that's a really a big issue we need to cope with because not all farms are huge and have a lot of employees on their own. And also the employees, they could need breaks and you need extra people. I think we need to really work on the labor solutions a lot in Europe to be for the future. And as for my perspective,
better, thanks.
Okay, perfect. I'm sorry. I'm finishing soon. I see also that I've been around for many years. We have this farmers occupational health farming services with health centers for farmers and so on. They're really good. And we see that farmers there, and also in our studies, that farmers are not, and from international studies, we see that farmers don't like to go to the doctor. And if they go to doctor, they feel they don't understand me and they say, maybe you need to take a break, you need to sick leave, but I'm not possible. I can't do that. So we need to find a system where we can make farmers having an annual health screening. I think that would be very good if they go and check out their health values, and then also they can also pick up if you have any mental problems. That's the easier way to start talking about them. If you see a professional nurse or something that have a very good knowledge about agriculture and the rural situation. So I think it's important that we keep up the good work. SafeHabitus are doing great, and we need that energy to get things going. But as I've seen so many programs over the many years to end, we had this fantastic program of Sakurima as well. That was great as a network. And there is a lot of organizations and networks around the globe, but often it's a split situation, split impression, and often we don't have any lasting situation. And in Europe, we don't have an organization. I think I really want to see that we can trust that we will be there for many years to come. And so I hope we can have something there in the future. And also I'm waiting to see the results of SafeHabitus and so on when the upcoming CAP and so on. So that politicians also make all this good stuff into reality, and so improvements will come. So thank you so much.
Thanks a lot. Thanks a lot, Peter, for your presentation. Very insightful lot on what to expect from the future and how to react. And yes, I was waiting for the last threat to the future, that SafeHabitus will end in December 2026. But I'm sure that the good work done by the researcher and the consortium will be used way beyond the project timeline. So I don't know if there are any reactions from this interesting presentation from Peter in the audience, any forward-looking and all the threats that we have had to deal with at the moment in the future. Otherwise, maybe Jarkko, you can let's say take the lead on also maybe building on what Peter presented to do, let's say, the final remarks and conclusion.
Yeah, thank you, Peter, and all the presenters. This came to my mind that basically one problem is that people forget 3 times faster than they learn. And that's why we should have this background of education and training and advisory, and together with spreading out the message, media, for example, that to keep this thing in mind. And that's one point. And then also that we need the networks. So basically that safety is there because farmer needs certain kind of safety. Then are the safety how the media is taking this message of safety, how they are presenting it to the farmers, how the education are handling safety, how safety is handling there in the government and public sector. All these matter, and also the manufacturers, how the manufacturers, machinery providers are taking the safety issues noticed. And we need this kind of a collaboration where we all go to the same direction. We are playing to the same goal. And now sometimes I see that if there is if in a team there is going to the different direction or playing to the another goal, then we don't play to the same goal, and that's one problem and challenge, that we are playing the same goal with the safety issue.
Okay, Jarkko. David, please.
Thanks very much, and thank you to all of the presenters and speakers. It was a very comprehensive overview of a lot of work that has just been, we've just skimmed the surface of it. So there's some resources that were put into the chat, and if you go directly to our website, you'll find them there. But Jarkko's point there about the number of organizations and stakeholders that surround farmers that need to be involved in these conversations is critical. Because and I was delighted that Peter was quoting Ramazzini from the 1700s in terms of, when I saw that quote, I thought it could be today. But the reality is that Ramazzini noticed that what we all notice, which is the fact that telling farmers to be safe is not going to be that effective. We need to support farmers to be safe. And that's exactly the point that Jarkko is making there at the end. And the way we support farmers to be safe is, in the first instance, developing that much better understanding of the realities and challenges that farmers face, and why do they do the things that they do? Why do they take the shortcuts that they do? Why do they make do instead of investing in new equipment or better equipment or safer equipment? And sometimes it is to do with money, but sometimes it's really, really practical. It's the fact that, well, I've got a barn and I can't get a big new tractor in there with a rollover protection system. So, So this is where the systematic element comes into, trying to understand why farmers do or don't adopt certain practices or technologies. And then what do we need to do as researchers to enhance understanding, but then to influence the other stakeholders that surround farmers. So whether they're advisory services, providing that ongoing knowledge and awareness and education and training that Jarkko was just mentioning there as well, has been really, really important to reinforce the message of safety. And then there's the policy makers. So what can they do in terms of adjusting policy to make sure that public funds can be used to enhance work organization on farms, the efficiency of the work being undertaken, and consequently the safety. So there's those elements, and then there are really important stakeholders in terms of machinery manufacturers and the suppliers of goods and services to farms. They also need to be involved in this space. And this is really what, if we think about it, this is really what we want from a community of practice. We want to bring people together to share that, to exchange knowledge and get a better understanding of the challenges that each of them face, and to identify and map out solutions to the future. So it isn't a case anymore of just pointing at a farmer and saying you should be safe. It's a case that everyone has actions to take. And that if we can coordinate and take those actions, then we can support farmers to be safe in the future. And so that's, in terms of my overall comment to what I've heard today, I mean, this is how I would try and pull it together. But there are probably others that want to come in and either disagree with some of what I said or maybe add to what I've said. So just a very quick thank you. And that was my comment.
Yeah, maybe I can make this very quick comment also. I think the SafeHabitus in Finland, at least what I have observed, I think it has really brought together a lot of people who have had very meaningful discussions of how to improve these supporting structures, how to make the services better so that the farmers can deal with the daily situations and problem situations when they potentially occur. And so that I think a lot of very good activity has been raised by the community of practice and other activities there. So it's been nice to see that.
Yeah, I see some messages in the chat thanking everyone for the presentations, the speakers, and I think Jarkko, I think we arrived to the end of this webinar, and I just want to take 1 second to thank again all speakers, but also all participants that decided to join us today. And yes, we have last but not least, tomorrow, Jarkko and John with the third webinar for this series on conducting a risk assessment in practice. So I hope to see you tomorrow as well. And well, enjoy the rest of your day. Thanks a lot to everyone. Bye bye.
Thank you. Bye.